It is 7 minutes before 7 a.m. This is Metro Morning on CBC Radio 1, and this week we are looking at the role that artificial intelligence will play in our lives and in our workplaces. On Monday, Jesse Hirsch kicked off this series of conversations by speaking about AI's increasing importance in the healthcare field.
Right now, there are algorithms being developed that can detect mental health based on your usage of your smartphone, that can detect physical health. It's remarkable how the technique of diagnosis is leaving the domain of professionals and getting into the world of technology.
It's Jesse Hirsch. Quaid Morris is a professor in molecular genetics and computer science at the University of Toronto, studies the intersection of AI and biomedical research, and is with us in studio now to talk more about artificial intelligence and medicine. Good morning.
Good morning.
One of the things that people have been predicting, we've heard this a couple of times this week on the program, is that doctors will be replaced. Not all doctors and not completely replaced. But how long do you think it'll be before our doctors' visits are actually with a machine rather than a human being across the table?
I'm not sure that that's ever going to happen. Or if it does happen, it's only going to be for very routine visits.
What do you think will happen instead?
Well, I think AI is going to make doctors more efficient at their jobs. Certainly, I think what's going to happen is they're going to make fewer mistakes. But I think the most exciting thing that AI can do is give doctors access to new information that they didn't have before, or allow them to detect patterns that they're not already good at detecting.
What does that mean?
Well, so the new information would be things like taking information about a patient's DNA and using that to help diagnose their condition, or taking information about cancer DNA to decide on treatment or a prognosis, how aggressive this cancer is going to be.
Who does that work right now?
Lots of people do that work. I mean, I would say that that's a major focus of biomedical research is trying to understand what DNA means and what it might mean for our health.
And so are those people who are doing that work, are they likely to be gobbled up by AI as AI becomes more prominent and thinks deeper?
No, I don't think so. I think AI is going to make their work better because a lot of the people doing that research right now are collecting data. And what this new type of deep learning does is it needs a lot of data to detect patterns. So, the data collection enterprise will continue to go on, and the contribution AI researchers can make is detecting patterns that are associated with health.
What is capable in the medical field right now? If you think of AI, what is possible right now?
So, I mean, in the near future, I think that we are in a position to detect patterns that doctors aren't looking for. I know I'm repeating myself. But for example, one thing that I'm interested in is trying to. Let me give you an example.
Yeah.
Okay. So an example I think a lot of people have heard of is Angelina Jolie. She had a double mastectomy. Because she was at high risk for breast cancer because she had a defective version of a gene called BRCA1. Upon hearing that, a lot of women had their BRCA1 tested. They had their DNA sequenced, and the test is to look for mutations that would indicate that they have a defective version of that gene. The problem is that there's no one mutation that causes the defective version of the gene, and a lot of mutations don't break that gene. So at this point, that you come back, a lot of women have BRCA1 mutations, but very few of those mutations are harmful. What does the doctor do? You have a BRCA1 mutation. We don't know if it's harmful or not. What can you advise a patient to do?
Yeah.
But we have enough data now to answer that question. So some of the mutations we know are harmful. Some of them we have no idea about. And we could train an AI system to distinguish between harmful and not harmful mutations.
What is most tantalizing to you about the prospects of AI and medicine?
I really do think it is augmenting what the doctor can see. The other thing that I'm very interested in would be identifying patients who are at high risk of having a health crisis because they have a complex series of diseases that they're currently managing very well. But say they get pneumonia and everything changes. No longer are they able to manage those diseases without help. Doctor can't really detect those patients coming in because the information that you need to understand who those patients are is distributed among a lot of different databases.
This is very optimistic. outlook? I mean, because there's a lot of fear and concern about what AI could do, but this is what you're saying is it could make us healthier.
I think that's the important role that it can play. Yeah. I mean, I don't think you can replace doctors. Nobody wants a machine to make life or death decisions for them. There's been autopilots for a long time in planes, but I don't want the pilot not to be there anymore.
Quaid, thank you.
Thank you very much, Matt.
Quaid Morris is a professor in molecular genetics and computer science at the U of T. He studies that intersection between AI and biomedical research. We're going to keep talking about artificial intelligence and what it will mean for our lives and future.